7:13 now. You may have high blood pressure and not even know it. Dr. Brent Wallis from People's Health joins us with some tips this morning for keeping your blood pressure in a healthier range. Dr. Wallis, good morning, good morning to you. What exactly is high blood pressure? Let's start with that.
Sure. So blood pressure is actually a measurement of the pressure of blood pressing against the walls of your arteries. And so, what we do is we measure it with a top number and a bottom number. The top number, which is called the systolic, is the pressure when your heart beats. And the bottom number is the diastolic, which is the pressure when your heart is relaxed. So high blood pressure is any time those values are higher than normal.
And what I've heard from folks is in the medical field is that the top number is the one that you really are focusing on. Is that right?
Well, actually, both numbers are very important. In general, the top number can get a lot higher than the bottom number, so people don't worry as much about it. But the bottom number can be just as important because when your heart is relaxing, you don't want that pressure to be real high.
Okay, well, that's good to know. So, and there are often no symptoms. I mean, somebody feels like they're 29, just like or whatever.
Yeah, very frequently there's no symptoms at all for high blood pressure until it gets really high and uncontrolled. And so that's why it's so important to see your primary care physician often. If you haven't been in a while, you definitely want to go get checked. Every time we see someone, we check a blood pressure. That gives us a baseline value, and then we can monitor that and see if it goes too high, and that gives us a clue into whether or not we need to treat it.
So what are the health risks for somebody sitting at home listening to this? Why does this matter?
Yeah, it's very important because that high pressure against your arteries can cause damage to the blood vessels, and that damage can result in a lot of different things, but in particular heart disease, heart attack, congestive heart failure, and then even stroke. So that's why it's so critical to make sure that blood pressure is well controlled.
And in terms of how you can fight this, I know a lot of it is what we talk about a lot is lifestyle, diet, exercise, that sort of thing.
Yeah, that's absolutely critical. Maintaining a healthy weight, making sure you exercise, usually 30 minutes, 5 times a week is adequate. But then also making sure that your diet's really good. Fruits and vegetables, low salt is really important when you have high blood pressure as well. And if you smoke, you absolutely have to stop.
And you can really pile on those sodium counts with processed foods and all that stuff I love that you find in the middle of the grocery store.
Yeah, potato chips, but definitely canned foods, and even a lot of frozen foods are preserved with salt, so make sure you're reading the labels as well.
Well, that's a great point. I was going through the grocery store, and there was some little, I won't mention the name, but in the frozen food section, there was some little vegetable, sort of healthy, low-calorie thing, and I opened it up, and it was hundreds of milligrams of sodium, so you really have to be careful.
Yeah, definitely. They sneak it in there for flavor, but it really elevates your pressure.
All right. Dr. Brent Wallis from People's Health, we appreciate your time as always this morning. Thanks.
Thanks, John. Have a great weekend.
All right, you too.